I'm Dr. Mark Duffy. I'm an ophthalmologist and an oculoplastic surgeon. I work at the Green Bay Eye Clinic. I specialize in eyelid surgery and surgery of all things related to the eye. Of all the procedures that I do, probably the most common is a blepharoplasty. A blepharoplasty refers to a procedure where you remove excess skin and weight from the eyelid in order to elevate the upper eyelid or smooth out the lower eyelid. For people who wonder if their eyelids are significantly droopy or it may actually be affecting their vision, the most common signs, symptoms, or findings that people might feel are that they raise their eyebrows all the time. If you're starting to get a lot more wrinkles on your forehead, or you look at pictures of yourself and you always have your eyebrows halfway up your forehead, or you look surprised, you're probably doing that subconsciously to open your eyes more. People that do that all day long tend to get very deep wrinkles in their forehead and get very fatigued towards the end of the day, finding it very difficult to keep their eyes open when reading or watching TV or doing near tasks such as knitting or sewing or other hobbies. Another common sign that your eyelids are probably droopy is that you have what we call a chin lift or a neck lift, where you walk around like this all day long, looking down your nose at the world because your eyelids are droopy. People with very droopy eyelids will adopt a chin-up position because they can see better looking forward with their chin up. It's not uncommon to have patients who've had neck problems and seen chiropractors, neurologists, had MRIs and never found anything wrong with it, only to find out later when they have their eyelids done that their neck problems were simply because they were walking around with their head tilted back in odd positions all day long to see better. If you found that you're giving up driving at night, you found that you don't go out to restaurants because you can't read the menus, or you find any dim light situations very difficult, you've become one of those people that has to turn every light in the house on and get a spotlight just to read, those may be signs as well that your eyelids are droopy and simply blocking the natural light from getting into your eye. Your brain actually sees by virtue of how much light that comes in, and when your eyes are droopy, frequently you're only getting 10-20% of the normal amount of light that might otherwise come in. Sometimes these can be due to cataracts or other eye diseases, but frequently as one gets older, they're also due to drooping eyelids. So if you found that you're giving up a lot of activities that you love and that make life worth living, simply because you feel like you can't see well enough to do them or you're uncomfortable doing them, it's worth getting an evaluation by an ophthalmologist. Oftentimes a simple surgery can restore a tremendous quality of life, and it would be a shame to give that up if you didn't have to.